In our summit rounds this week, we talked about preparing for surgery and specifically preparing for a plan for managing post-operative pain. And I want to talk a little bit about that and some insights that we gained in our discussion this week. One of the main concerns patients have going into surgery is control of post-operative pain. It is my opinion that if a plan is in place, the anxiety and fear associated with pain can significantly be reduced. So just taking a moment to think about what you are planning to do and talking with your provider about what the plan is for management of post-operative pain can have a significant benefit in reducing the anxiety and fear that you may experience. A part of that plan is understanding the various medications that may be used. We use Tylenol regularly. We use nonsteroidal anti-inflammatories regularly, such as Celebrex and Toradol. We use muscle relaxants, and we also use tramadol and oxycodone, depending on how significant the pain is, as a narcotic. Of course, we want to use narcotics at the lowest effective dose for the shortest period of time. We also use ice and bracing. And then I think that there is a psychological component here. The mindfulness approach can really and significantly help patients manage postoperative pain. And having a mindset of paying attention to the symptoms, having a plan in place for what you're planning to do with a particular type of pain, and then simply executing the plan and accepting the fact that surgery is associated with discomfort and pain. Most of the time, it is very manageable. On occasion, it becomes significantly difficult to manage. My experience has been that the times when it's most difficult to manage are either when something wrong has happened at surgery, which is relatively uncommon, and we would let you know if that was the case, or if the patients have a lot of anxiety associated with their pain. So for that reason, and many others, I recommend that you take a moment to consider your own personal plan for management of postoperative pain and counsel with your provider on how to do so.